Hey, today we're going to focus on diabetes mellitus disease, types of diabetes, causes of diabetes, complications of diabetes, and some advice on what to do. If you have not subscribed to this channel, please hit the subscribe button and also hit the notification bar so that you can be notified every time I post videos like this one. Thank you. Diabetes is a condition that happens when your blood sugar, glucose, is too high. It develops when your pancreas doesn't make enough insulin or any at all, or when your body isn't responding to the effects of insulin properly. Diabetes affects people of all ages. Most forms of diabetes are chronic, lifelong, and all forms are manageable with medications and/or lifestyle changes. Types of diabetes. The most common forms include type 2 diabetes. With this type, your body doesn't make enough insulin and/or your body's cells don't respond normally to the insulin. Insulin resistance. This is the most common type of diabetes. It mainly affects adults, but children can have it as well. Prediabetes. This type is the stage before type 2 diabetes. Your blood glucose levels are higher than normal, but not high enough to be officially diagnosed with type 2 diabetes. Type 1 diabetes. This type is an autoimmune disease in which your immune system attacks and destroys insulin-producing cells in your pancreas for unknown reasons. Up to 10% of people who have diabetes have type 1. It's usually diagnosed in children and young adults, but it can develop at any age. Gestational diabetes. This type develops in some people during pregnancy. Gestational diabetes usually goes away after pregnancy. However, if you have gestational diabetes, you're at a higher risk of developing type 2 diabetes later in life. Causes of diabetes include insulin resistance. Type 2 diabetes mainly results from insulin resistance. Insulin resistance happens when cells in your muscles, fat, and liver don't respond as they should to insulin. Several factors and conditions contribute to varying degrees of insulin resistance, including obesity, lack of physical activity, diet, hormonal imbalances, genetics, and certain medications. Autoimmune disease. Type 1 diabetes and LADA happen when your immune system attacks the insulin-producing cells in your pancreas. Hormonal imbalances. During pregnancy, the placenta releases hormones that cause insulin resistance. You may develop gestational diabetes if your pancreas can't produce enough insulin to overcome the insulin resistance. Other hormone-related conditions like acromegaly and Cushing syndrome can also cause type 2 diabetes. Pancreatic damage. Physical damage to your pancreas from a condition, surgery, or injury can impact its ability to make insulin, resulting in type 3C diabetes. Genetic mutations. Certain genetic mutations can cause MODY and neonatal diabetes. Note: long-term use of certain medications can also lead to type 2 diabetes, including HIV/AIDS medications and corticosteroids. Symptoms of diabetes. Some of the symptoms of type 1 diabetes and type 2 diabetes are feeling more thirsty than usual, urinating often, losing weight without trying, presence of ketones in the urine. Ketones are a byproduct of the breakdown of muscle and fat that happens when there's not enough available insulin. Feeling tired and weak, feeling irritable or having other mood changes, having blurry vision, having slow-healing sores, getting a lot of infections such as gum, skin, and vaginal infections. Note: type 1 diabetes can start at any age, but it often starts during childhood or teen years. Type 2 diabetes, the more common type, can develop at any age. Type 2 diabetes is more common in people older than 40, but type 2 diabetes in children is increasing. Complications of diabetes. They include coronary artery disease, heart attack, stroke, atherosclerosis. Other diabetes complications include nerve damage, neuropathy, which can cause numbness, tingling, and/or pain. Nephropathy, which can lead to kidney failure or the need for dialysis or transplant. Retinopathy, which can lead to blindness. diabetes-related foot conditions, skin infections, amputations, sexual dysfunction due to nerve and blood vessel damage, such as erectile dysfunction or vaginal dryness, gastroparesis, hearing loss, oral health issues such as gum, periodontal disease. When do you need to see a doctor? If you think you or your child may have diabetes. If you notice any possible diabetes symptoms, contact your healthcare provider. The earlier the condition is diagnosed, the sooner treatment can begin. If you've already been diagnosed with diabetes, after you receive your diagnosis, you'll need close medical follow-up until your blood sugar levels stabilize.